you know what TB is? TB means tuberculosis is spread by inhaling tiny drops from the cough or sneeze of an infected person. We are constantly suffering from sneezing and coughing. Does this mean that we are suffering from that disease? No, we are not. Tuberculosis TB is a bacterial infection caused by Mycobacterium tuberculosis, mainly affecting the lungs. Still, it can affect any part of the body, including the stomach, glands, bones, and nervous system. About 1/4 of the world's population is infected with TB, which means that people have been infected with the TB bacteria but are not yet infected and cannot be infected. People infected with the TB bacteria have a 510% lifetime risk of getting TB. People with low immunity, such as people living with HIV, malnutrition, or diabetes, or those who use tobacco are at higher risk of getting sick. Your body's immune system can prevent you from getting sick even after the disease. Your body's immune system can keep you from getting sick even after you have the disease, and sometimes it can be the cause of your highest risk. That is why it is divided into two parts, like latent TB and active TB. You have a TB infection, but your body's bacteria are inactive and do not cause symptoms. Latent TB, also called an active TB or TB infection, is not contagious. Latent TB can turn into active TB, so treatment is essential. This condition makes you sick and, in most cases, can spread to others. It can occur weeks or years after a TB bacterial infection. There are some signs and symptoms of active TB include coughing for 3 or more weeks, coughing up blood or mucus, chest pain, or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, loss of appetite. Tuberculosis can also affect other parts of your body, including the kidneys, spine, or brain. When TB occurs outside your lungs, signs and symptoms vary according to the organs involved. For example, tuberculosis of the spine might cause back pain, and tuberculosis in your kidneys might cause blood in your urine. When a person has active TB disease, the symptoms can be mild for many months. This can delay the search for care and can lead to bacterial infections, among others. People with active TB can infect another 515 people within a year through close contact. Some people develop TB disease soon after becoming infected, within weeks before their immune system can fight the TB bacteria. Other people may get sick years later when their immune system becomes weak for another reason. Overall, about 5 to 10% of infected persons who do not receive treatment for latent TB infection will develop TB disease at some time in their lives. For persons with weak immune systems, especially those with HIV infection, the risk of developing TB is much higher than for persons with typical immune systems. This could be someone they live or work with or a close friend. It usually takes 8 hours or more exposure for enough TB bacteria to build up in the body to be a risk. These are common to low-incidence countries like the UK and high-incidence regions such as Africa and Asia. TB tends to cluster in urban areas. London has over 40% of the TB cases. Worldwide, just 22 countries have more than 80% of the world's TB cases. Homelessness or living in poorly ventilated or overcrowded accommodation. TB bacteria can spread more quickly and remain suspended in the air for longer in poor housing conditions or working environments. Tuberculosis TB is 100% curable if treated with the approved 4-drug combination for 6 months. You will start feeling better within 2 to 4 weeks after starting treatment. However, it is essential to complete the course of antibiotics, or the disease will worsen. If you do not complete the treatment correctly or do not adhere to the treatment course, the TB bacteria may get more robust and symptoms may resume. This is called drug-resistant TB. It is more complex and challenging to get rid of, and it may take longer to treat. Additionally, you will start spreading the disease again. Your doctor or health worker at a public healthcare center may provide the information, supervision, and support for your treatment adherence. If you have a TB infection, but no symptoms, you have a slight chance of developing TB in the future. Therefore, you may get short-term preventive treatment to stop the onset of the disease with the same drugs from your doctor after discussing the situation. So friends, if you have any of the above symptoms, you can cure it now and let us know your condition by comment. So guys, stay healthy and stay with health conscious.